IRG's Health Talk continues.
All right, our next guest, Charles Cobbs, Dr. Charles Cobbs, a neurosurgeon at Swedish and director of the Ben and Catherine Ivy Center for Advanced Brain Tumor Treatment, Brain Cancer Awareness. Shannon, it's something that we always need to be thinking about and something that we're going to be talking about today.
Yeah, you know, Tom, I always like talking to Dr. Cobbs. He's been on before. I mean, some of the stuff and research that he's doing to battle these brain tumors, particularly these glioblastomas, very, very significant brain tumor. And, you know, it takes research, it takes money, it takes effort. And the Brain Cancer Awareness, Brain Cancer Walk, Dr. Cobbs is passionate about what he does.
Shannon O'Kelly and Dr. Charles Cobbs.
Dr. Cobbs, welcome back to Health Talk here. How are you?
I'm doing great. How are you all?
We're doing great. We're excited to have you on. You've come on before. You've got quite a role, quite an important role as the director of the Ben and Catherine Ivy Advanced Brain Tumor Treatment Center right here in Seattle. And this being May is Brain Cancer Awareness Month, and you guys just celebrated an annual brain cancer walk. Let's talk about your walk, and then I want to talk about what you're doing. What's the latest and greatest research in brain cancer? You know, it's one of those cancers that, boy, I tell you personally, I would love to see some kind of advancements here.
Absolutely. Well, we definitely need some breakthroughs. I can tell you that right now. But first, I'll tell you about the walk. The walk was started back in 2007 by my predecessor, Greg Foltz, who used to be the director of the Ivy Center here at Swedish, just as a sort of a thing for families and patients to celebrate and to get out and to get a community going. And after now in its 14th year, we've celebrated every year the Brain Cancer Walk. Usually we do it at the Seattle Center down under the Space Needle, but in the last 2 years, because of COVID, we've done virtual walks. But when we can do it outdoors, it's a wonderful event. We have all types of musicians and sort of street performers that come out, and there's a huge number of patients. We've had over 3,000 participants in the years that have in the last several years before we had to go virtual. And it's a great time really for families and patients to get out and see the community and to reinforce the commitment of the community to treat these patients, take care of these patients, and also very importantly to fundraise to do research for brain cancer.
Let's talk about the need to fundraise, and let's talk about brain cancer. But more importantly, Dr. Cobbs, you have a very special role there, and you're an active clinician, an active researcher. You wear many hats. Tell us about your cancer research at the Ben and Catherine Ivy Cancer Center, Advanced Brain Cancer Center there, right here in Seattle. You're doing some wonderful stuff. Tell our listeners the wonderful stuff you're doing.
Well, absolutely. Yeah. So I do walk on both sides of the fence. I see patients. I just saw 2 patients today with brain tumors, and it can be a very devastating diagnosis, especially the glioblastomas and malignant gliomas, which are the most common, unfortunately, in adults, but also highly malignant tumors. And these tumors have had very little in terms of improvement in overall survival over the last 20 to 30 years, as opposed to some things like breast cancer and lung cancer, where there have been some massive breakthroughs for some of these tumors. What my lab has been focusing on is basically 2 strategies. One is to identify the core cells or the stem cells within these tumors, which seem to be the cells that make them come back after treatment. And we've got a clinical trial now where we're isolating these cells, growing them in the lab, and then subjecting them to dozens of FDA-approved drugs to try to give the patients a personalized treatment for their tumor. And that's going well. And we have good safety data, and hopefully we can move that into a phase 2 clinical trial so that we can have a personalized treatment for each patient. I would say I'm most excited about the field of immunotherapy, which is a massive area of cancer research for all different types of cancers. But brain tumors have been resistant to the standard immunotherapy approaches. But in our lab, we're trying to take patients' tumor tissues and identify very specific things that we can target the immune system to that will attack those tumors and get rid of them without chemo or radiation. And that's really the end game from my perspective. And the goal is to have your immune system attack the tumor.
More with Dr. Charles Cobbs and Shannon O'Kelly after this time out on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
We're continuing our conversation with neurosurgeon Charles Cobbs and Shannon O'Kelly.
This month of May, you had your brain cancer walk on May 2nd. Congratulations. And just real quick, just a personal thank you to you and your organization. I lost my mom to a glioblastoma. She was 63 years old, way too young to pass away. And I watched this cancer take her and take her personality. And, I'm just hopeful someday we have a breakthrough. And people like yourselves raising money to fight this. Why is brain cancer so hard to fight? And what are the challenges when you talk about biologics and the blood-brain barrier? It's just such a complex area.
Yeah, first of all, I'm very sorry for your loss of your mother. And, every time I see a patient, it just really hits home how the research we're doing really affects people, and we need a breakthrough. But to answer your question, these tumors in the brain seem to not have all the markers on them that make some of the immunotherapy drugs work. So they're kind of invisible to the immune system. So we're trying to figure out strategies to identify unique things about them that we'll be able to use to target the immune system. My lab has historically been interested in a possibility that a virus infection is in these tumors, so you can vaccinate against the virus and get a response to the tumor. And that's being done at Duke University and University of Florida based on some of our work previously. But we just need to get over the radiation and chemo stage because it hasn't really provided those breakthroughs we need and advance from that into biologics, like you said.
Yeah, no, so let's let our listeners understand this. So in a summary, basically what you're doing is you're taking some kind of virus that looks like a virus, and you want that to have affinity to the tumor cells, and then you can put medicine in that then attacks those tumor cells because they look like a virus, or they look and act like a virus. I'm just trying to summarize here so our listeners understand the biologics.
Well, there's two different things going on. My group is actually finding evidence that there is a virus already in the tumor, and if we can vaccinate against that virus, we can draw an immune response that attacks the tumor cells specifically. Other researchers around the country are actually using engineered viruses to infect the tumor and then have them cause the immune system to attack the tumor specifically, or for the virus to carry with it a sort of a suicide gene that'll kill the tumor cells specifically. So there's all types of approaches, either approaching a virus that's already in there or infecting with a virus. But it seems like if we can get the immune system really ramped up to attack these tumor cells, it would be a huge gain, because right now they really are hiding from the immune system. Other tumors like melanoma are much more visible to the immune system, and that's why they've responded so well to immunotherapy.
Man alive. I mean, I just listened to you. I have this feeling of hope. What kind of things can we help you with to keep this research going to someday there's treatment for these glioblastomas and these malignant brain tumors?
People can always go on and look up the Seattle Brain Cancer Walk. It's always open and available to contribute. When people fund our work here, it's really trying to do out-of-the-box thinking and experiments. So that's what we greatly appreciate, all the donors and philanthropists that have helped us over the years.
Wow. Thank you for what you do. I'm looking forward to having you on in the future to update us. Thank you.
Thank you so much for having me.
You've been listening to Dr. Charles Cobbs and Shannon O'Kelly talking about brain cancer awareness. And, of course, they had the Brain Cancer Walk, the virtual walk that took place May 2nd. You can get more information, support.swedishfoundation.org. We'll have another guest coming up for you next, right here on Como.